Hello, my friends. Welcome back to my channel. Today, I'm Dr. Nirmalya Deb, Consultant Orthopaedic Surgeon. I'd like to speak on the common anti-resorptive medicines for osteoporosis. So let's break a common myth. Myth is that if you take calcium, the bones become stronger. Well, which is absolutely not so. Because once you take calcium, calcium only helps in the formation of the bony structure and maintenance, but it does not promote or does not modify osteoporosis, which is disease of the decaying bones, which we see in old age, and fractures resulting from this kind of osteoporosis, which we call as fragile fractures. Calciums are not the only drugs which can help in osteoporosis correction. So, what are these drugs? So, let's talk about the safest drug apart from calcium or vitamin D, which is the first line drugs for the treatment of osteoporosis. Let's talk about drug per se, which helps in the treatment of osteoporosis. One such molecule is injection denosumab. So this molecule is unique in the fact that this has very low incidence side effects. It can be administered to patients with renal impairment, renal disease, chronic kidney disease, as well as patients with liver impairments or hepatic failure. So the drug is very safe. It can be administered to anyone except during pregnancy and lactation. So the other thing is that there's a huge, very comfortable compliance in that this can be taken only once in 6 months, not daily. And the injection is only under the skin. It is not painful. It is not the classic injection which you see and observe and which you are scared about. Is the injection into the arm or injection into the buttocks. It's not that. It is only a pin prick, small prick under the skin. It's very safe. It can be administered by a healthcare professional, a nurse or an attendant in your own locality, or it can be done by the industry itself when they come to offer the injection to you. So this is a very safe drug, like I mentioned. So this is to be taken once in 6 months for a period of 3 to 5 years, twice annually, and it's a huge safety profile and helps in the maintenance of osteoporosis. So who are indicated? Females in the postmenopausal age group who have a high incidence of high probability of fractures, the fragility fractures or fractures resulting in osteoporosis. How do we measure that? We measure using a simple DEXA scan. So if you have a DEXA scan center in your locality, which is very much present in our urban population, in our urban cities, so you can go there and your patient will recommend a DEXA scan once in a year. So if your DEXA scan scores are low, then you take this injection once in 6 months, which will help you rebuild your bone and stop the osteoporosis levels. So women who are past the post-menopause and who have high incidence of fractures as measured on DEXA scale are very good candidates to take this injection. Number two, males who have crossed into the sixth or the seventh decade of life and who have a very low DEXA scan score, they're also good candidates. Some cancer patients are also very good candidates, and it helps prevent fragility fractures. So these are in brief the indications, common indications for which we can prescribe injection denosumab. So what are the common adverse reactions? Well, practically clinically, I have not witnessed any significant reactions, but there are some reactions. Like there could be a skin reaction, there could be a hypersensitivity to the drug, there could be a fall in the calcium level, there could be some other sensitivity reactions. But these are very on a minor scale and without less toxic symptoms. So one thing you must note is that when we administer these kind of drugs, the calcium levels must be corrected. Otherwise, there is a tendency for the calcium level to fall in the serum, blood levels. So you take concomitantly blood, calcium, vitamin D to maintain the blood levels, and with that we can take injection denosumab. It's a very safe drug. And then once you stop this drug after a period of 5 years, in which you maintain and you once in a year you check up your DEXA scan levels, see how your osteoporosis is getting corrected. And once you stop that, you maintain that by taking oral drugs which help in the bone resorption, which help in the decay of the bone.
So this is in brief an overview for all my friends, for all my patients, and for all those who are listening about the role of injection denosumab in the prevention of osteoporosis. So if you have any questions, do post them to my chat box and I'll be happy to answer them for you. Thank you very much for tuning in, for listening this day. Thank you very much.